appoint president over judges is what the Standard is saying. Mr. Mwakesi, over to you.
Tricks, for me, it's very simple. If you have an allegation against a sitting judge, we do not want people who have serious integrity issues or even light integrity issues sitting in office.
Okay.
Please go ahead, have them removed. The Constitution gives the mandate to JSC, to the President, to go ahead, and even Kenyans to petition to have those people removed. Let's not have people with any question or as to their integrity sitting in office as High Court judges or even Court of Appeal judges. They should be gone by now.
Okay.
So let it not be the reason for the standoff. Otherwise, if you cannot be able to bring something or substantiate against the High Court judges, then appoint to the Court of Appeal so that we can get over this hurdle and we move Kenya forward.
All right, Mr. Osido.
On the same note, Tricks, in my view, is to also give them a hearing. We have had lots of allegations against these 6 honorable judges. I think it would also be fair, and the Constitution gives them an opportunity to be heard. Let the judiciary in its own existence provide opportunities and avenues for which these particular judges could be heard, and then we begin to have an opportunity to provide redress, because it is in my view that if the JSC found them fit to hold office and to be appointed as Court of Appeal judges, it is in the President's constitutional requirement that he actually goes ahead and does so. And if there are issues, as he's already raised them and has already been canvassed, it is of course within their rights to also be heard. And if they are interested in presenting issues that where they feel that their judgments went the way they went, provide that kind of jurisprudence, and then let's ensure that we implement the Constitution and also safeguard the interests of the citizens who also sit at the highest apex of offices like judges, while also ensuring that institutions work in unison, both as dependent organizations but also serving Kenyans as interdependent government institutions.
Okay, now let's shift gears to matters coronavirus. Now, the Kisumu County government has come up with measures to curb the spread of coronavirus as health facilities in the Lakeside County get overstretched by the day. As of June the 5th, the county had recorded 5,739 positive cases cumulatively. KTN's Kevin Ogutu reports on a crisis that has since been further complicated by inadequate testing reagents at the county referral hospital.
Kisumu County Referral Hospital, by virtue of its proximity to the Central Business District, has been the most ideal facility for those seeking to get tested for COVID. However, when KTN News came here on Tuesday, it was anything but a designated COVID-19 testing point. The 3 people we found here still harbored hopes of getting tested, despite being informed by the medical personnel here that there were no testing kits.
I went to Guru Nanak Hospital, then they give me some first 2 or 3 aids, and the receipts for the treatments are here. Then they sent me to County Hospital for the test. So when I came to County Hospital, so far I met a lady over there. She told me of the Department of Testing COVID. She told me that they do not have kits for test totally. For the 72 hours, past 72 hours, they haven't had any test kit. Yet they're running out of it, so it's very difficult to do it without the test kit. That's the reply I was given.
Nataka nijue juu nimekaa kwa nyumba for almost 1 week, nataka nirudi kazini. Sasa nataka nirudi na certificate kama nirudi nayo, nipate certificate nirudi nayo niwapeleke watu wa kazi kama at least imerudi chini.
At the Jaramogi Oginga Odinga Teaching and Referral Hospital, this corner has been dedicated for testing COVID-19, but it is such a slow process with only 1 person attending to the clients. But first, you need to pay 50 shillings. Kisumu County government had warned that it will crack down on public service vehicles on Monday. It is, however, business as usual for touts working in the public transport sector. Putting on a mask is such an alien thing, it looks like there is no COVID-19 in Kisumu City. Most of these matatus ply routes to Manyata and Kondele, where positivity rate is highest. The week of 31st May to 5th of June, 780 cases were reported, with Kisumu Central leading at 317 positive cases. Manyata, Nyalenda and Milimani residential areas have been leading in the last 3 weeks. According to Nyong'o, mortality rate within the county has increased from an average of 12 at the peak of last year to a new peak of 18 per week.
Everybody is to blame, and we have had a lot of lackluster behavior in Kisumu for a long time. But all fingers point to the county government, because they had known that we are coming to a crisis in Kisumu. We were aware that we are going to have Madaraka Day in Kisumu. And when we were having the first jab of vaccination, not all people who are eligible who are supposed to be getting the vaccination got it.
In an elaborate press statement on Monday, Kisumu Governor Professor Nyong'o listed a record 13 measures to curb spread of COVID-19 in the county. One of them is crackdown on public service vehicles and boda not complying with COVID-19 protocols. Interment of bodies within 72 hours after their demise, mortuaries not to keep dead bodies for more than 48 hours, and members of the public being banned from physically attending churches, mosques and temples. Kenya has lost over 3,000 to COVID-19 since March 2020. The Ministry of Health has cautioned Kenyans living in Nyanza and surrounding regions of the risk of contracting COVID-19 infection. The ministry also says that the number of persons diagnosed in Kisumu are projected to continue rising through the months of June and July. With such key facilities like Kisumu County Referral Hospital unable to test COVID-19, it is possible that the number of infections out there could be higher than what is reported. Kevin Ogutu, KTN News in Kisumu.
All right, now the officials that are battling COVID-19 at various health facilities, according to the article on page 11 of the Standard, are among them are those charged with the responsibility of making policies in the department. So they are supposed to be helping battling it at a management level, but they themselves getting the coronavirus. Now, Homa Bay County Health Administrator Eli Odhiambo announced the closure of the offices on Tuesday, and Eli Odhiambo said they had closed the offices for the next 1 week. Now, this is a situation that is ongoing. We are told also wards in public and private hospitals are full, while laboratories don't have the reagents to continue with their tests. So it's not looking very promising. And this had been predicted by health experts, especially following the Madaraka Day celebrations. Mr. Osido, when you see this, what comes to mind?
Quite a very unfortunate scenario. Tricks, because in my view there is a lot that we need to do, and that has to do with the preventive elements of dealing with COVID-19 other than curative elements. Preventive, yes. so much such that we're able to enhance our public education mechanisms. For instance, a story by my good friend Ogutu says that there are tents at Jaramogi Oginga Odinga facility, but yes, only one person is there to attend to Kenyans, and under normal circumstances, particularly when you look at how we have done our community health education and public health education campaigns or even rallies, you would probably have had, sounds of public address system, talking to citizens, sharing information around why it is important for them either to, exercise the COVID-19 protocols and all come for vaccination. And then the service part of it is to ensure that you have, human resource and you have facilities then that are also able to serve and safeguard these particular citizens. That is not what we are seeing.
Yes.
And for the people in Kisumu, and particularly coming up after the Madaraka Day celebrations, where they said that Baba contracted COVID and he healed, and he was able to take away all those kind of their sins for COVID-19 and the infections. Those kind of narratives will demand that you have health care workers coming out to debunk them and to let citizens know that this is a virus that is here with us, and that the personal responsibility is very, very important. Such kind of events, such as super spreader, events like we saw during Madaraka Day, in my view, should not have been Of course, it was expected because that was a historic day for Kisumu City, but government should have put in place effective measures and or the expectation that the cases would be going up or that citizens would then be able to want to see the kind of leaders who are there, including the president, the former prime minister, the deputy president, among others.
Right.
So that then this week we should be having intense, testing of COVID-19. We are having the health facilities around Kisumu and the 14 other counties in the Lake Region Economic Bloc also enhancing their testing and, just public education to ensure that we are actually putting in place measures. And lastly is for citizens to know that the further and the more we continue to have this virus among us, of course, business is going to be affected. You've heard the measures that Kisumu County is now putting in place.
Right.
It is us who are actually going to be, affected in terms of our social gatherings, our social, nomenclature around how we want to live our lives on a daily basis. So the faster we abide by the COVID-19 protocols, the faster we'll be able and the quicker we'll be able to deal with this vaccine, with this virus. And the sooner we get back to our normal lives.
Right. And inter-county movement, while it cannot be prevented, clearly it's having an impact, and the epicenter for the coronavirus is slowly moving away from Nairobi to the other parts, and Kisumu and Nyanza has been in focus lately. Mr. Mwakesi, what do you make of this? Do you think the counties are ready to handle the magnitude of such a tragedy if the spread continues as it is today?
The counties, I don't believe, are very prepared for this particular occurrence. There has to be more enhancement measures to ensure that the level of preparations are at a level that can be able to contain the kind of surge that we're expecting. Right now, Nyanza region is dealing with about 3 variants of that particular coronavirus. So it just shows you how serious it could potentially be, because just containing one variant is an episode on its own. Already from the Ministry of Health, and there's a letter that I saw that the Council of Governors were written to by Dr. Patrick Omoth,
yes,
that the counties need to really ensure that they really increase the amount of isolation facilities available. I mean, we were serious about isolation facilities, but then it seems counties became lax about ensuring that such facilities exist and are kept ready to be able to contain cases once they come about. There's also the issue of oxygen supply. We have not seen enhanced measures to ensure that we can be able to make sure in all the counties, from all the way from Bomet, Siaya, Kericho, all the ones that are surrounding Kisumu are able to cater to patients the moment they require additional oxygen to be provided to them. So I think on my part, for the county governors, it's time that they really put out a brave face and demand for additional resources for this particular containment measures. And for those county governments which have not been very keen on ensuring that they have enhanced their capacity to enforce some of these measures, such as ensuring that meetings are kept to the bare minimum. I know in that region right now, you can only do meetings of 15 persons in every session. The other thing that I know has been very concerning, especially in that region, is the question of public transport. There has been complete disregard to the measures when it comes to public transport. So it's something that needs to be very much enhanced. We need also to ensure that Kenyans are able to access clean, safe water, plus masks and